Hello. Today we are discussing a very important topic in the field of implantology. As we all know, implantology is prosthetically driven. So today I will be talking about the very important aspect about the prosthetic part of implantology, that is good lab versus bad lab. So I will show you a few cases. You can have a closer look. Focus here. Now these are few cases that are going on. So I'm just showing you how the poor lab work looks like. See, this is a case of we are planning a cement retained zirconia here. So these are your two straight abutment for cement retention. Now initially this lab guy technician had planned this crown. You can see this crown has been prepared by the lab guy. Now you can see the bulk of the molar. It is extremely bulky. Buccolingual, it is so extensive. The buccolingual occlusal table is very big. So this crown will have lot of offset forces on the buccal cuspal angles. So this is a very bulky prosthesis. Instead of this lab guy should have made 3 crowns. So then I had to tell him that kindly make 3 crowns. Now still it looks little bit better. Now the buccolingual occlusal table is of a lesser dimension. So this should have been done from the lab technician from the beginning. Okay, that shows that this lab technician is not well trained. Okay, secondly, now the most important point is that if you look at the intaglio surface, it is concave. There is a depression here. It is concave. See, this is still better. But in this, if you can see, there is intaglio surface is concave. It should have been convex. Intaglio surfaces of the fixed prosthesis, whether crown and bridge dentistry or whether implant dentistry, has to be always convex because it is a fixed prosthesis. If you give a concave intaglio surface, then there will be food lodgement. It will act as a undercut area. Okay, so convex intaglio surface. That is, now this also suggests that this technician is not well trained and it is not a good quality work. You can see the same process if I show you. This is the case. This is one of the cases that we are doing with tilted implantology. This is a pterygoid implant and this is the tilted implant here. These are your quick dent implants. Okay. Now we are going for multi-unit abutment level screw retained prosthesis, DMLS prosthesis, PFM. Okay. Now have a look here. This is first of all from the photograph of the articulator only you can make out this is a poor lab work. This is the hinge articulator which is now extinct, but still these labs are using it. So this is one point is there. Now look at the prosthesis. Okay, extremely concave intaglio surface. This is a extremely concave intaglio surface like a bowl. It is like this. Okay, so this will definitely have food lodgement. That shows this is a poor lab quality work. Now if you look at the internal surface of the prosthesis, it is very dark and rough. I'm just talking in layman terms so that every dentist can understand. Okay, it is very dark and rough. It looks like a castable PFM. And if you look at this good lab work and see the internal surface, it is very fine and smooth. This is your actual DMLS, which is made by laser sintering. Okay, you can make out here the surface is very smooth and this surface inside is very rough, which looks like a castable local work. Okay, so now the point of this discussion is that whenever you choose a lab work, go for a good and standard lab because that good technician makes lot of difference in your final prosthesis. Remember, implantology is prosthetically driven. It is not surgically driven. So if you do a very good surgery and your prosthesis is of poor quality, then the long-term prognosis will be poor. Your whole work of good surgery will go to waste. So always choose a good lab with a good technician so that you get a very good prosthesis which will ensure a very good long-term prognosis of your implant. Thank you. If you have any queries and if you want any particular topic that I should discuss about, please leave a comment and I will make a video about it. Thank you.